We've been telling you about it all morning, the great defection defying a veto threat from the White House. 39 Democrats in the House voted to approve a plan that would go further than President Obama's short-term fix for Obamacare and let people keep the plans they're already happy with. Let's get reaction from Wisconsin Congressman Sean Duffy, who joins us live this morning from Madison. Congressman, thanks a lot for coming on.
Hey, good morning, Tucker.
How have these Obamacare regulations affected your constituents back in Wisconsin?
Well, like everywhere in the country, I'm seeing a lot of my constituents who are losing health care that they like, and it's at a price that they can afford. But there are really personal stories that are taking place out there. I have one constituent who's in line for a kidney transplant, and she has insurance, and it covers the transplant when she'll need it. She's got a cancellation notice. So she's going into the exchange, and there's only one option for her in rural Wisconsin for health care coverage that would work for her in the exchange, and it doesn't cover the transplant. And so, listen, she's losing her doctor, she's losing her coverage, and she's absolutely terrified. This is life and death for a lot of people, and if we don't get this fixed, it's catastrophic. I have other kids. I have Max, who's a college student, whose insurance is going up by $150. He can't afford it. He's going to go without. In small-town America, Warren is in Thorpe, Wisconsin. He has a doctor in his community that's covered in his current health care plan and insurance. He's losing it, and he's going to have to travel 70 miles away to his new doctor. This isn't working for a lot of people, and we're hearing the stories as members of Congress nonstop.
Well, the irony is, of course, that Obamacare was designed, at least putatively, to help people exactly like the ones you just mentioned, and yet it's hurting them. Why didn't the administration foresee this? Why didn't they see it coming?
Well, I think we both know that the administration did see it coming. And that's why the misrepresentation that if you have your health care and you like it, you can keep it, period, is such a lie. In Wisconsin, Tucker, almost 95% of our citizens are covered with insurance. We could have worked to find that other 5 or 6%, get them coverage, instead of wiping the slate clean and now taking a lot of people who have insurance, taking them off. Remember, Tucker, the president said he was all about redistributing wealth. Well, he's taking health insurance from middle-class, hardworking families and giving it to people who don't have insurance. This is really painful stuff. And oftentimes with this economy, when these prices go up for this new Obamacare insurance, our families can't afford it.
Yeah. Congressman, as you know, the profile of the families losing their insurance, the self-insured tend to be small business people, tends to be Republican. You think that's an accident?
Well, listen, I think it's not an accident that he's trying to get everyone into a more government-run healthcare system.
Yeah.
And, you know, I don't know if it was Republican or Democrat, but what I do know is it's hurting my constituents, and we have to have a fix. And you talked about the president's administrative fix that came earlier in the week. Listen, that's no fix at all. No. That's going to be another misrepresentation from the administration.
Well,
we need to have big fixes to this plan or repeal.
Exactly. Congressman, thanks a lot for joining us.